So when you talk about mental health, it's a big stigma, and we may call it something else, feeble-minded or something else, but we don't like to call it mental health, and it's a strong stigma.
Mental health is a state of well-being where a person realizes his or her abilities to handle normal stresses in their life, able to work fruitfully, and they can contribute to their community.
Mental health is the goal. Mental distress and mental illness are the problems needing treatment.
A lot of times people interchange mental health with mental illness, but a mental illness is a condition which affects a person's thinking, their feelings, and their mood. And so a mental disorder can reflect your ability not to be able to handle the normal stresses of your life. It may it's a condition where it impacts your ability to work and how you think. And it may cause you to have some behavior that's unacceptable behavior in a community. And so when you're having panic attacks, or when you're very depressed, or you may be schizophrenic, where you're having hallucinations and you're not aware of reality in your life. And so it can be very, very frightening for individuals.
While African Americans make up 12% of the national population, we account for approximately 25% of mental health needs in the United States. The 25% is likely an underestimation since numerous cases of mental illness go unnoticed and unreported in our community. In the words of Dr. Janet Taylor, there are some African Americans who believe, I don't want anyone in my business, and I have to deal with my problems by myself. Without support from the community, or at least family and friends, how does a person begin to recover?
The largest mental health facility in central Indiana isn't a psychiatric hospital. It's the Marion County Jail.
I need water. Okay. I'm going to go get water. I'm going to get water. All right. Sit down.
In an hour of riding along with IMPD,
suicide prevention and Tasha are on the phone.
There were 5 mental health calls.
Person assaulted.
Some were dangerous.
This the dude right here? I'm going to reach back here and take that knife, okay? That's kind of a big knife, and I don't want anybody to get hurt.
Officers are specially trained through crisis intervention training how to spot mentally ill, perhaps getting them help instead of jail.
How about we go to the hospital so you can talk to some people? You gonna walk over to the ambulance?
Every day, officers determine if a person is mental or criminal.
We're now having our jails represent our mental health institutions, where people who have a mental health disorder or condition needs treatment, and they need that level of expertise to help someone be treated. Instead, they're arrested. Now, unfortunately, what do we know? 40 million Americans have a mental health disorder in the United States. That's roughly 1 in every 5 individuals have a mental health disorder. More frightening than that is a significant percentage of them are going to start their mental health condition at the age of 14. And by the time you're 26 years of age, 75% of all mental health disorders are going to be recognized at that time. Where people are being incarcerated, they may have a mental health disorder that needs treatment so that they're not repeat offenders. And we're not filling up our jails where people don't have the resources in order to treat them appropriately and correctly.
We want to encourage people to have honest conversations and start with the people that you are connected to, your friends and family.
Today, nearly 1 in 5 Americans are living with a mental health condition, from our children and grandparents to our veterans, co-workers, and neighbors. For all of us, our mental well-being is just as important as our physical health. But But unfortunately, most of us don't know how to recognize the signs that someone is in emotional distress. And so many of those who are having difficulty can't get the help they need. Together, we can change this.
It is important to know the 5 signs of emotional and mental distress. Personality. Their personality changes. You may notice sudden or gradual changes in the way that someone typically behaves. Agitated. They seem uncharacteristically angry, anxious, agitated, or moody. Withdrawal. They withdraw or isolate themselves from other people. Poor self-care. They stop taking care of themselves and may engage in risky behavior. Hopelessness. They seem overcome with hopelessness and overwhelmed by their circumstances. Have you noticed someone who used to be optimistic and now can't find anything to be hopeful about? You don't have to suffer and you don't need to wait. Help is always available. Mental health treatment works, and it is proven that early intervention is effective. The success rate for early treatment of mental illness is towards 80%.
We got to get rid of the stigma in our communities. People need help. And the earlier we know you make a diagnosis in these cases, better outcomes, and they become viable citizens so they can get that education. They can go to college or they can do that vocational training, but they can be productive citizens in this community.
We've been saying loud and clear to anyone out there who's hurting, it's not a sign of weakness to ask for help, it's a sign of strength.
And then it's up to us to show compassion, to reach out, connect, help folks find the hope and the support they need. Together, we can change the story about mental health in America. Together, we can change direction.
For non-emergency help, contact your primary care provider, neighborhood clinic, or hospital.